You think everything is going fine, you've had your checkups, you're eating right, and your baby seems okay? But here's the truth no one tells you. Not all pregnancy dangers are obvious. Some signs are so subtle, so silent, that even the most careful moms can miss them. And by the time they're noticed, it may already be too late. In this video, you'll learn 6 hidden dangers during pregnancy that often go undetected. These aren't meant to scare you. They're meant to protect your baby and your body before it's too late. Let's start with one of the most silent but serious signs. 1. Your baby bump isn't growing, or is growing too slowly. Q. Is your belly smaller than expected for your pregnancy week? Most moms expect their belly to grow steadily week by week. But what if it doesn't? Slow bump growth can be a sign of intrauterine growth restriction, where the baby isn't developing as expected. It might be due to placental problems, high blood pressure, or other hidden causes. Sadly, many moms only notice this late in the 2nd or 3rd trimester. That's why consistent measurements at prenatal visits matter, and why you should speak up if you feel something isn't right. So how do you know if your baby is actually growing well or falling behind quietly? 2. You're gaining too little weight, or even losing weight. Q. Can pregnancy weight gain affect your baby's survival? Weight gain in pregnancy isn't just about numbers. It's about nutrient transfer to your baby. Gaining too little weight could mean your baby isn't getting enough nourishment. In the 1st trimester, nausea may cause slight weight loss, and that's normal. But beyond that, if your weight plateaus or drops, it could signal a nutritional gap, placental problem, or infection. What's more dangerous? Some moms restrict food intentionally due to body image worries, not knowing they're putting the baby at risk. But if the baby is still moving, everything's fine, right? Not always. 3. Your baby's movements change, but not in the way you expected. Did your baby move today? And was it the same as yesterday? Baby kicks are one of the most beautiful parts of pregnancy, but they're also a critical clue to your baby's well-being. A sudden drop in movements, or even an unusual increase followed by silence, can be a sign of fetal distress. Many moms wait too long, thinking it's normal for babies to rest. But fetal movement patterns should remain fairly consistent once established. Always trust your instinct. If something feels different, don't wait until the next appointment. But what if you're not feeling any other symptoms? Can there still be danger inside? 4. You have a UTI, but no burning or pain. Q. Can a silent urinary infection really affect your baby? Yes, and it can do so without you even knowing it's there. Asymptomatic urinary tract infections are surprisingly common in pregnancy, especially in the 2nd trimester. You might feel fine. No burning, no urgency. But inside, bacteria could be traveling up your urinary tract, and if left untreated, may trigger preterm labor or kidney infections. The scary part? These are often only found through routine urine tests, so if you skip your prenatal checks, what else could you be missing? 5. Your blood pressure is creeping up, but you don't feel it. Q. Can high blood pressure hurt the baby even if you feel perfectly fine? Absolutely. Pregnancy-induced hypertension is one of the most dangerous silent complications. It often begins quietly, with no symptoms, until it leads to preeclampsia. By then, moms may develop severe swelling headaches. Vision changes protein in the urine. But by the time those show up, the danger is already building. That's why blood pressure checks at each visit are non-negotiable. But what if the baby's heartbeat sounds normal? Could there still be a hidden threat? 6. Your placenta is in the wrong place, and you have no idea. What happens when the placenta covers the cervix and no one catches it? This condition is called placenta previa, and in many cases, it causes no symptoms until late pregnancy. Suddenly, you may have painless bleeding or go into early labor. The placenta could be partially or fully covering the cervix, and unless found by routine ultrasounds, it can become life-threatening during labor. What's worse, some cases are missed entirely if ultrasounds are skipped or incomplete. So how do you make sure you're not missing these silent threats? Final message and call to action. The most dangerous part about pregnancy isn't always what you feel. It's what you don't feel. the danger you never saw coming. But here's the good news. You don't need to live in fear. You just need to stay informed, stay alert, and stay connected to your care team. Don't skip appointments. Track your baby's movements. Speak up if something feels off. And trust your instincts, because they're there for a reason. If this video helped you feel more aware or more prepared, leave a comment below. Have you ever experienced a pregnancy complication that came out of nowhere? Share your story. You may help another mom. And if you know someone who's pregnant right now, please share this video with them. It could make all the difference. Thank you for watching to the end. Don't forget to subscribe and stay tuned for our next video. 7 dangerous pregnancy symptoms that look normal, but aren't. Take care, Mama.